Welcome to the ninth talk of the 2021 Ottawa Sailing Community Winter Speaker Series, hosted by Nepean Sailing Club. My name is Stephen Kidd. I'll be your MC tonight. Injuries happen in our sport. Tonight's presentation is Concussions and Sailing, what they are and what to do about them. I've experienced a crew on my boat getting a concussion. This is a vitally important topic. The main part of tonight's talk will be given by NSC member Dr. Cathy Duchesne. Cathy is a physician with training in emergency medicine. She's co-owner of Corrie Doon, an Ontario 32 keelboat at NSC. Then Dominic will outline the responsibilities of sailors and organizers of sailing events. He's a photonics engineer in the telecom industry and races his Albacore dinghy Skye at NSC and has been race crewing on friends' keelboats. Now he has acquired his own J80, having gotten the bug last season crewing on one. Dominic recently completed a term as fleet captain at the club. Thank you very much, Cathy and Dominic, for presenting tonight. Audience, just a quick reminder to please use the Q&A box, not the chat box. So at the bottom of your screen in the center, you'll see Q&A for questions and answers. So please post your questions and comments there. Everybody will be able to see them. And so you can see, you don't need to be afraid if you're asking the same question someone else already has, you'll see everybody's questions. And you can also upvote others' questions. So just before we get to Cathy, who will begin our presentation, we're going to put up two polls. So Tony, if you'd like to, thank you. Number one, have you or any of your crew experienced a blow to the head while sailing in the last few years? And here are the results. Interesting. Others on the boat have more than us ourselves. And the second poll question, did you feel any pressure to continue sailing or racing, even though someone on board was injured? And our results. Thank you very much, Tony. All right, Cathy, over to you. Thank you very much.
Hello, everyone. I'm Cathy Duchesne, and I sail Corrie Doon with my husband, Don. We're on a dock. Everyone seems to identify themselves by boats around here. And I'm going to talk about concussion. I'm just going to share my screen with you. So here we go. Slideshow. So everything that I say tonight will apply to not just concussions in sailing, but also concussions in every other type of sport that we're doing. I see lots of you skiing up at Fortune regularly during the week. And the other things that they apply to are yard situations where you might get smacked in the head, falls anywhere in the yard or anywhere in the sailing club. And this will also apply to things like motor vehicle accidents. Now, we are going to talk about concussion, but just before I get to that, I actually want to talk about all the other things that are not concussion. I've been a family doctor for over 30 years, and I did practice emergency medicine until a few years ago at the Ottawa Civic Hospital and just retired. So we have seen a lot of concussions over the years. But what I want to make sure you understand is the things that are significant head injuries that mean that you have to call for help, you have to call 911, and then we'll get into also concussion and the management of concussed patients as well. So this looks terrible, right? This image shows up in a number of talks about head injuries, but this is actually not our problem. This is a Polish sailor who actually just smacked his head on a prop from his wind vane, and he has a scalp laceration. So he looks awful, and you'd think that this is the most important thing of all, but actually what we're looking for are things that are much subtler than this, that's going to take you a little bit of work to figure out what is going on. So the first thing I'm going to talk about are all the things that we would classify in the emerge department as head injuries that don't actually fulfill concussion. Concussion is a minor head injury. So I want to talk about injuries to the neck. I want to talk about intracranial bleeds, and I want to talk about skull fractures and just how to recognize these things before we move on to looking at concussions, because these are the red flag symptoms. So we'll talk about that a bit. So neck injuries are pretty common when you smack your head or fall. And the causes can be direct blows to the neck. So if someone is actually hit by a significant boom or something in the back of the neck, that's important. Or they can be caused by flexion extension injuries. So many people know about this from being in car accidents where you get the forward back thing and you can damage your neck that way. So if any of your crew or people that you're working with in the yard or whatever have one of these types of injuries where they've hit their head and they have neck pain or tenderness, and the other important one is numbness or weakness in the arms or legs, then don't do anything, just call 911 and get that person seen to at the emergency department. There's a number of things that the paramedics may be able to do to distinguish who needs to go to hospital, but that's up to them to figure out before you proceed any further. And if you're seeing something like that, try not to move the person until the 911 crew gets there. So the next thing that I want to review as well is intracranial bleeds. There was a case where a skier injured her head. It was Liam Nelson's wife, I believe, who smacked her head skiing and landed up with an intracranial bleed afterwards. The lovely picture that you see at the bottom right-hand corner of the screen is a picture of a brain. That big white semi-lunar area that's showing up there, that's blood. And that's the kind of thing that you have to go to the operating room for. So it's very important that we know a little bit about this and that we understand that in this situation, it's quite different and you really have to call someone. Now, a whole bunch of you are, I know, in the same age group as me. And a lot of the sailors are taking anticoagulants, which are blood thinners for things like atrial fibrillation, heart disease, previous strokes, things like that. These people are particularly prone to getting intracranial bleeds. And so our rule was in the emerge department, if you had a head injury and you were on anticoagulants, especially the warfarins or some of the newer anticoagulants that you might be on, those people would get scanned almost without fail if they'd had any kind of significant injury. So now that doesn't apply to everyone. Not everyone will be on blood thinners, but if you see someone who is unconscious, I can't imagine you wouldn't call 911 for that, seizing. But the other things that are a little more subtle that you might see are progressive symptoms. So doctors always worry about progressive symptoms. If you see progressive symptoms of headaches or confusion, these are the cases that we really want you to call for help for. And if someone's vomiting more than once, usually in adults it's twice, those are also the people that we want to scan in the emergency department. Double vision is another one. So for any of these situations, I want you to call 911 and get some help. Okay. Now, skull fractures are a little different. This is a lovely picture of a skull. And you can see that there's a whole bunch of tiny bones in the face, nose, maxilla, mandible, all this area in here. And then this great big area for skull fractures. If you think someone's been hit and you think it's a skull fracture or a facial fracture, also send those people to a hospital right away. These are, because a lot of these have to be dealt with surgically. Skull fractures are usually the result of a direct blow, but they can be a result of a fall and hitting a significant hard impact. But they're usually impact kind of injuries. So for all of these things, we want you to call 911 and we don't want you to deal with it as a concussion. So what about concussion itself? What are we talking about when we talk about this? So Concussions can be caused by any kind of a blow to a head or any kind of an acceleration deceleration injury. So if you can imagine the brain is floating inside a skull, and if you suddenly stop that, the brain keeps on going. And so you can have direct injuries that we call coup or counter coup injuries, which means that it smacks into the skull. But there's also problems with the shake part of it, which can cause significant problems and can cause concussion. So you don't even have to hit your head to do this. You can see this from significant falls, like somebody who falls skiing off a height and hits the ground without smacking their head. I've seen this happen. You can just suddenly lose consciousness after that. You do not have to be knocked out to get a concussion. People often think that that's the case. But you may feel like you've had your bell rung, which is a common thing that people describe when they're doing sports that are contact sports. So these are the kind of things that can cause concussions. This is a neuron. This is what your brain looks like on the inside. And all these tiny little fibers that go out from them, especially the main fiber called an axon, can be disrupted by things like the shake injury or the acceleration deceleration injuries. So that can cause problems. And that's one of the theories about what causes the trouble with concussion. There's some other possible explanations, including it may change some of the neurotransmitters, which are chemicals that allow your brain to communicate. This is Rowan Stringer. Many of you will have heard of her. Rowan was 17 when she died in 2013. And she died of something called second impact syndrome. And the reason that she died is this problem, the original problem of concussion was unrecognized, both by Rowan, her teammates, and her coaches. So our goal tonight is to make sure that you understand how to recognize concussion in your friends, your teammates, and anybody that you're sailing with. So maybe people are thinking, well, why is it important? Why do we need to recognize it in the first place? Well, one of them is the problem that we just discussed, which is second impact syndrome, which can be fatal. And that happens when you get repeat concussions. But there are a number of other things that are a problem for people who've been concussed. One of them is post-traumatic vertigo. So you can have prolonged episodes of dizziness after concussions that can last months to years. Post-concussion syndrome, which we see quite frequently in the office, where people have symptoms a long, long time after they've hit their head. And the last one is something that's receiving a fair bit of press from groups like the NHL and the CFL, which is chronic traumatic encephalopathy, which is a dementia illness that may be related to having multiple head injuries. So all of these things can be the long-term problems with being concussed. Now, I'm going to talk to you about recognizing concussions, but the picture that I'm showing you is not how you do it. That lovely scan that shows, that's actually a contrast scan of a head, and nothing will show up if you have concussion. If there's something showing up, then it's a different problem. It's one of the other head injury type problems or bleeds that I've told you about before, but concussion shows up with nothing. So scanning people is not helpful for this. The important part is that we understand how to spot these things in the people that we're sailing with. So the first thing to think about is the person who's been hit in the head or has had one of these sudden deceleration injuries may not be able to tell you that there's a problem right away. So you need to think about the things that you have to watch for that would tell you that they've got concussion. Basically, if they've got symptoms after a head injury, then you need to think about concussion. And then there's a number of things that would tell you that their brain is not working. And those things might include, you may see that they're just staring off into the distance, not able to really identify things, not able to register what's going on in the environment. Something called delayed verbal expression. So you may be talking to them and it takes them a long time to respond, or they don't seem to quite understand the question that you're asking. They may not be able to focus their attention, so they may not be able to do the next task that you're asking them to do on the boat. They may be completely disoriented. They may not know the time or the place or what date it is or what exactly they're doing. Or sometimes you'll see people run the wrong direction on the sports field, for instance, that kind of thing. And these are all very, very important symptoms. They may be slurred or incoherent, so it may sound like they've been in a bar for a couple of hours, but they're just not right because of their brain not working properly. You may see emotional outbursts that are very uncommon for that person, so crying for no reason or getting really irritated or agitated or angry for no reason. And one of the primary signs is memory deficits. So they may not remember what happened just before the impact. They may keep asking you the same question over and over again. So they're not remembering the memories that they've just laid down in the minutes or so after the accident. If you ask the person, what they may describe is that they're just in a fog, that their brain's not working correctly. It's important to realize that any one symptom will get you the diagnosis, you don't have to have all of these things. Anything that you see is important. Now, what's next? Well, maybe their body's not working either. So they may have to tell you some of these things, but there may be things that you can see as well. So the person may complain of headache or head pressure. That's probably one of by far the commonest symptom that people complain of, is that they have a headache after they've been smacked in the head that keeps on going. They may be uncoordinated. They may not be able to walk down the dock correctly or walk on the boat correctly. They may complain of being dizzy, blurry vision, not being able to see properly. They may get tinnitus, which is ringing in the ears. They can be very sensitive to light or sound. They can also be really fatigued or drowsy. So if you notice that someone's kind of not awake, then, or seems to be extremely drowsy when you're talking to them, that's also an important sign. And we talked about nausea and vomiting already, but the concussed person can be just nauseated, especially as part of the dizziness, and they may vomit, but if they vomit more than once, then they need to be seen immediately. That's a 911 call. Okay. You may see that they've got some minor facial injuries. And the last one that you're probably not going to run into on the boat, but is important to keep in mind for yourself or members of your family, is that they may have sleep disturbance after they've been smacked. And again, any one of these things is important and needs evaluation. You can check them out. You can check them out by asking. So commonly the things to ask are, do you know what day and date it is? Do you know where we are? And it may be more specific than just we're on the Ottawa River or we're at the sailing club. You may want to figure out whether they know exactly where they are on the Ottawa. If you're racing, you can, and it's a competitive environment, or even maybe not, you can ask, what mark did we just pass, or what landmark did we just pass on the river? What boat is ahead of us, or what boat are we going to meet if you're cruising? And who won last week's race? Or who did we visit with last week when we were on the water? And perhaps how did we finish last week in the racing environment? And that will allow you to have a chance to see if they've got any amnesia or any confusion about what's going on in the environment around them. So if you identify a concussion, then it means that that person has to sit out of the rest of the sports event that they're involved in. So what that means for the rest of us is we have to go ashore. Because we're not just on a field where the person can sit on the sidelines. We have to get them off the water. Do not leave this person alone. And this is not the time to pull out your bottle of Tylenol and the rum from the bar to help out. There's no medication, no alcohol in this scenario. And for sure, no driving. Do not let this person drive home. They need to be sent with a responsible adult to be assessed. And the assessment can be done by their doctor, by the nurse practitioner in their clinic that they attend, can be done by a walk-in clinic, or at the hospital if those things are not available. But we would expect you to have the person looked after in some way. Now, I've told you a lot of things and you don't have to remember all of them. They're all in this document, which you'll see again, which is a concussion recognition tool. And this is available for upload. Ontario Sailing has a sample, and there are many samples on the web for various sports. So I just want to remind you about the red flags again. So if the person says if you notice that someone has neck pain or tenderness, if they have double vision, if they're tingling in their arms or legs after a head injury, if they've got a severe or increasing headache, if they have seizures or convulsions, if they're unconscious, and if they're vomiting more than once, if they're agitated, restless, or aggressive in any way, or and then one of the more important ones that you need to kind of keep tabs on and why you don't want to leave them alone is, are they getting more confused? Any of these scenarios, call 911, get some help, get the person properly assessed in the emergency department. Now, I was asked to talk about return to sport because, you know, your buddy who you sailed with last week that got clocked may be saying, oh yeah, I'm coming back to sail next week again. And so now your job is to tell them that they are not coming back. Only a medical practitioner decides when the person can return to sport. This is not a decision that's made by teammates or usually the sport body itself. It's even in schools now, the medical practitioner has to clear the patient before they're allowed to return to things like gym class. If it's a minor head injury, it will take 6 or 7 days before they're able to return, because there's a number of stages that I'll show you in a second. And the other thing is that before they return to any competitive kind of sport, they must be symptom-free. So they need to actually be clear of symptoms before they can come back. And this is probably most important for the sail racing for the young kids. We do this all the time for the kids who are involved in hockey, in rugby, all the other sports, and we go through this whole process with them, and they have to see us on a couple of occasions before they're allowed to return. The stages are put out by a group called parachute.ca, and I've put the link up on top. Each of these stages takes at least 24 hours. And at each stage, they have to be able to do the next piece without developing increasing symptoms. And ideally with no symptoms, but definitely not, it can't make their symptoms worse as they go up. So stage 1, they have to rest for 24 to 48 hours, which is really, really limiting activity, and just brain rest is the whole idea. And then they can do a little bit of light household activity, but that first stage will take them at least 24 hours. Then they can move to stage 2, which is some light aerobic activity like walking or doing some minor aerobic activity. Stage 3, they can do some sport-specific activity with no contact. Stage 4, they can do some training drills. So that might mean going out sailing, but in very light weather. And to get to clear to go back to sailing, they need to be cleared by a physician to do that. So stage 5 and stage 6, where they allowed to practice or allowed to go out in different weather conditions or returning to racing, they have to be cleared, and someone has to say that they can do that. I'm sure someone is going to ask me about helmets, and helmets are very useful in preventing head injury. They've shown significant reductions in injuries such as cycling, and may help in this scenario. They're not, I'll let Dominic deal with what the organizations are saying about helmets, but it is important to realize that helmets will not prevent all concussions. And part of that is because you can still get those acceleration, deceleration injuries, even with a helmet on. And even some of the fancier ones that allow rotational movements within the helmet and things like the ski helmet I own will still not prevent all episodes of concussion. So you still have to keep it in mind, even if you're sailing with people who have helmets on. So I think I can stop there, and we can go on to what Dominic has to say about what the issues are with the various sailing organizations and some of your legal responsibilities around this scenario.
Thank you very much, Cathy. You want to share? I will share, and we'll be good to go. Before I start the presentation as such, we have been recently building this page on the Nepean Sailing Club homepage about the fleet concussion policy and protocols. Just go to the NSC homepage and type the word concussion in the search box, and you'll be able to find some documents and information. And we will be putting this presentation slides up there at a soon to be determined date. So you can get this information again afterwards, and of course you can watch it on the YouTube channel. So as Cathy said, she's a medical expert, so she spoke about medical matters. I'm not. But I get to speak about the sort of organizational matters and your responsibilities, my responsibilities, and the club responsibilities. So I'm a member of the Fleet Committee, and this presentation has been approved by the relevant NSC board member as a result of the work of the Fleet Committee. So I'm going to talk about the law, what it applies to at NSC, so what events and activities, and who it applies to, and what the sailors need to do, and what the event organizers need to do. Here's a nice graphic at the bottom, taken from the Volvo Ocean Race of an injury that can happen in sailing. This gentleman is standing up, sudden unexpected change in the wind, and the boom comes across and bumps his head, and he goes flying. I don't know if he's concussed or not. I don't have the results of his concussion recognition tool test, but certainly many of us have had encounters with the boom. And as Cathy said, there are other ways that you can get injured. There can be a slip and fall on the dock, slip and fall on the boat. We know one event last year where a boat went bow first into a rock, and a person fell on the boat as a result of that sudden deceleration. There's our friends Ben and Kate wearing their helmets. The helmets, just to summarize that, I've not seen any official word from Sail Canada or Ontario Sailing about helmets. From US Sailing, there's a very soft recommendation from a 2019 conference that they had, that they should be recommended and promoted for racing activities, and particularly for the youth and kids. but no mandate has come down, and there's no regulations instructing us to use them in any circumstances. So that's as far as I want to go on the helmet topic. Cathy has already spoken about the medical aspects of that. So the sort of trigger for this is Rowan's Law. Cathy introduced who Rowan was, but the sort of the background of it, or the impact on us, is the root cause that the government and their advisors recognized was twofold. It was athlete pressure. It's just a knock, I can keep playing. Or there's a big game tonight, my team needs me. Or it's the qualifiers, it's a big event, I have to compete, you know, if I want to progress to the next level of my playing capabilities. Or, and this particular little guys, coach pressure. You'll be fine, shake it off, go in. I think this is certainly something, language we've all heard of. Or we need you to play, we're facing a strong opponent, we need you to represent the team. So those are some of the pressures that that maybe were behind the events that this particular player's passing, and that's largely what the new law is intended to solve, is directly to address those pressures. What are our pressures in NSC sailing, or as sailors are around the lake? Just one more race in the regatta. I can't disappoint my crew. It's windy and they can't handle the boat without me, so you know I got to be there. And I kind of had this one once. I traveled all this way, I'm not going to drop out now. You know, I had that. That's happened to me. Oh, I bought new sails, I gotta go and play. So these are some of the pressures that we may feel in sailing to continue even when perhaps we shouldn't. And it was interesting that the survey we had at the beginning of those that said they had been an injury situation on their boat, 1/3 of the respondents who said they'd been in a situation said yes, they'd felt pressure to continue the sailing activity. So you know, I think it's evidence that this is a real thing, and so we need to be careful. Even in a local event, but certainly as we go up in more structured events. So in Ontario, over the last couple of years, the law has been gradually rolled out, and the final rollout is it's middle of the summer. It's called Rowan's Law. It is Ontario provincial law. There is no federal equivalent. To the best of my knowledge, there's no other equivalent in another Canadian jurisdiction, and it's actually a world leader. If you want to read the text, go to Ontario CA laws and search for statutes and regulations and look at the Rowan's Law. It has two aspects. It has the law, which is the first of those entries, and the regulations, which provide some more detailed implementation. And both of them are mandatory. We have no choice but to comply, and in certain circumstances, you have no choice but to comply. So that was one of the triggers for putting together this this presentation. It applies to things called prescribed activities at sports organizations. The law is short and it's in plain English, so humans can understand it. The key points, all the sailing clubs are sport organizations. There's no doubt about that. We have prescribed activities. I will list them on the next page. What this means is the club is required to do certain things, and in some cases, our sailors are required to do certain things. And as I say, these are requirements. They're not optional. We must perform them. The law doesn't prescribe penalties, but you know, the law is something that we follow. So that's what we do. Now, which NSC fleet activities have new rules? And we've looked at we studied very, very carefully, and we've defined two categories. And essentially, it's fleet activities that involve competition, particularly those that involve competition in a series. A lot of the law, a lot of the background is about, you're fine, shake it off, go back in next week. So a lot of the language in the regulations address kind of series, but not exclusively. So we've divided it into the activities on the left, where the regulations apply, and activities on the right, where there's no regulatory requirements. But you know, as Cathy has spoken to, in any activity, an injury can occur, and even outside the formal requirements of what we have to do, you know, you should definitely follow the concussion recognition tool guidelines, even in any such activities, particularly when you're out there on the water. So the activities we're particularly concerned about are regattas, Harbour Masters race, weeknight racing, whether it's around the buoys or the time trials, long distance races, keelboat race practice, that's the key one for those that do that, and the single-handed keelboat race when you're out there racing on your own. So in all those activities, as part of the registration, whether it be online with a checkbox or whether it be some kind of paper with a signature, going forward, you will see a concussion requirement in your registration process. We started that 2 years ago, actually. First event we did that for was, I think, the Able Sail Regatta, and you'll see that consistently going forward. So when you see that, there's a reason for it. Age. Age is not perhaps quite what you think. Rowan's Law publicity is aimed at the young contingent, specifically under 26, and even more strongly at kids under 18 and their parent or guardian. But, and this is critical, it took a long time to recognize this, some parts of the law apply to older persons too, older athletes too. And for simplicity and to have a single process that everybody can follow easily, the fleet concussion protocols at NSC apply to all athletes, regardless of age. I'll briefly mention the Sail Training Center later. So it applies to all athletes. Okay, who are these athletes? Well, here's a list of the athletes, a defined picture of an athlete there. All these people are athletes because of what they're doing. It doesn't mean that they feel they're big, strong, Olympian or anything. No, it's because of what they're doing. This is the definition. Park is an athlete. He races his boat. Melanie, Derek, and their kid on the J80, including the kid, are athletes because they go out racing. Carolyn raced cruise on a 27. She's a athlete. Jade is a younger person. She's from Quebec, and as I mentioned, we're just applying this broad brush to everybody that registers for a prescribed activity at NSC, to keep it simple. We have some good friends, older friends, Doug and Kay, that come up from the US for regattas, and they are athletes when they're up here. Not an athlete, Rick, he has a J24 at NSC. He doesn't race, he likes to go cruising, so he's not an athlete in the regulatory context. Randy, he's got a nice big boat. He races turkey trot, and we put that, because of the structure of that event, it's outside our prescribed activities, so he doesn't have to follow the regulations. We would still advise Rick and Randy to carefully follow the concussion recognition, however. If it's one of these activities, everybody on the boat's an athlete, even if they only come out for one race of the series. So, again, we've studied this carefully at the committee. I took a 70-year-old guest out for one race in the series, and they just drank rum. Yep, they are an athlete. They are covered. We see a nice rum drinking ceremony here. My 3-year-old plays in the cabin when we do weekend upriver races. Yes, they are an athlete in the context of how we need to behave and report. So bear it in mind, everybody on board doing one of these activities is an athlete, regardless of how athletic they may be acting or behaving. Briefly, the Sail Training Center moved actually earlier than Fleet, and they've had a very strong process already since nearly 2 years back. They simply picked up Ontario Sailing's concussion procedures for sail training centers and implemented them soup to nuts. They are a coach-led environment. They're highly structured, and that means the coach is really the supervisory person for all their activities. So they've implemented that. So if you want more information, look under sail training at NSC. So that's a different, but they have a different environment, as you understand. That's a closed environment, coach-led. Fleet is out there in the middle of the lake, not so much coach-led. So we've got a slightly different set of procedures, which we're just deploying now. So we'll talk to the responsibilities, what NSC needs to do, what the sailors need to do, and what organizers of events need to do. So what NSC needs to do, what must do, is drive awareness, such as publishing the web page with the links, such as this presentation. We've created, or rather, we are making it easier to access the incident report template, which the club has had forever. We're going to make it easier to access, and now we're going to make it easier to access the return to sport protocol, which is new from the perspective of NSC. So those will be available on those locations, websites, notice boards, and the office. And Sean, our sailing activities manager, he's responsible for execution of this part of the responsibilities. So this is about helping to educate you and helping you to report and track issues. Boat owners, what do you need to do? And this is boat owners who are going to participate in one of those prescribed activities. That was the list in the blue box that I showed earlier. So you are required in the law to review the Government of Ontario's concussion awareness resources every season, once per year, before registering the boat to race. And in the registration, you will be required to acknowledge, as the boat owner, the person doing the registration, that you have done that. So you can find those, just search for Ontario Concussion Awareness Resources on the internet, very, very easy to find, and they're well written. And they have them for different age groups of people, you know, so that even younger kids will be able to be aware. And there's an adult directed resource there as well. So read that. It's, you know, it's straightforward. In a sense, it's an alternate presentation of what Cathy showed us earlier. Makes yourself aware of the protocols of how to recognize a concussion, how to obtain and fill out an incident report, and then you, the boat owner, are responsible, if the concussion is suspected, for ensuring that the removal from sport and return to sport protocols are followed. You are the responsible party under our protocol, not the club, because we're not providing training and it's not a closed environment. So the boat owner, must emphasize this, is responsible for executing that legal requirement. And to help you work out what this means, when you register racing, you must agree to the NSC Code of Conduct for owners of boats participating in NSC racing, and that is that code of conduct is linked on the NSC website that I showed you earlier after searching for the word concussion. Crew, you have responsibilities too. You have to make yourselves aware of the tools and protocols. You need to be aware of the NSC Code of Conduct for racing crew. You don't need to sign anything. So this is more about education, educating yourselves, being able to act, but you don't have the legal requirement that the boat owner carries. What the fleet event organizers, so people that have organized regattas, people that organize weeknight sailing, people that organize keelboat race practice, you should drive awareness, engage your participants through skippers meetings, guides, posts on your event website so that they can find the materials that we've published and discussed. Make sure that your race registration waivers have the necessary acknowledgement that we mentioned on the previous page, and make it easier for competitors to find the necessary information. And as the event organizers, like the chair of the regatta, I'm chairing a couple of regattas this year, so I have responsibility to make sure that the people who come to that regatta are able to do these protocols very, very easily. What do the NSC fleet staff and volunteers have to do? So, and this is important, there is a nuance here. The race bosuns, that's the staff, the race officer in charge of a race course, so that would be like the principal race officer or the lead race officer, and any volunteer formally delivering training have to also review these resources. Again, once a year before your first activity of the season. So formally delivering training, that covers the keelboat race practice. Make yourself aware of the protocols, how to recognize a concussion, how to obtain and fill out an incident report, and agree to that fleet code of conduct. You don't actually have responsibility to pull a participant off the water. You'll notice that's not listed there. And that's after a careful read. And the reason is, in our context, you're running a race course, the incident may happen a kilometer away. You will not be aware of it. So you must be aware of the protocols and trained, but you don't actually have a responsibility to act on the water. Other race committee, like the people that the run timers and flags and so on, judges on off-water volunteers, there's no requirement for you to take an action under this protocol. So hopefully that's clear. Okay, so Dan, will you sort of reiterate what Cathy showed us? You're out there on the water probably. You think that a head injury may have occurred. Now what do you do? Assess the situation. Follow the concussion recognition tool, which is this chart that Cathy flashed up. I'm not going to go through it. That's available in many places. It tells you how to look for the symptoms, how to recognize them, and what to do about it, as was summarized earlier. After assessment, after performing this recognition, or simply if you're confused, return to the harbor immediately. Stop your activity, get everybody back to land. If there's any red flags apparent, which is the red pictures on that recognition tool, call an ambulance. Follow the instructions on the concussion recognition tool, and Cathy went through those later about earlier about what you should do. And then from an administrative responsibility, so the boat owner has responsibility to make sure the following happens. If the injured party is a minor, contact the parent and guardian. So that's the boat owner's responsibility to make that happen. And obtain and fill out an incident report and send it to the sailing at nsc.ca address, which is shown our activities management. And these are requirements. These must be done. It's in the regulations. So that's and that's incident report is because the club now in the regulations and law has a responsibility to track the a return to sport protocol. We don't do the medical assessment, but we have a responsibility to receive a statement from a qualified medical person to say, yes, this person can go back into the sport activity. We have a requirement now to receive that before we'll allow that person back into the activity. So that's why the sailing activities manager is now responsible for tracking these things. So as I said, the removal from sport and return to sport protocols are required. So make sure you submit that incident report. That's our removal from sport protocol. Before racing again, seek the medical attention as showed, and must fill out the return to sport form. The NSC Sailing Activities Manager will work with you on this. He's not a medical person. He doesn't perform any medical act. So he just ensures that you've got the necessary clearance from your medical expert. So that's our process. So this will be online. You can find how to behave, and we should be able to keep ourselves safe out there. So as we're developing this, my final page, there were three questions that came up repeatedly in our analysis. So we present them here as FAQs. It seems the boat owner has all the responsibility for following the protocols. That is indeed correct, with the one exception being where there's a trainer present, where they both have responsibility for getting the person off the water and getting the documentation done. So yes, the boat owner is a designated person in the language of the law. Why don't crew need to agree in writing to follow the protocols? Because the intent of the law is to drive awareness of and ensure adherence to specific concussion policies and protocols, and making the boat owner responsible achieves this because the boat owner is the one who deals with their crew, and that complies with the regulations, and the boat owner is the center of focus now. What if the boat owner is not in the boat when a head injury occurs? Some people lend their boats for racing, or maybe the boat owner wasn't able to come to that particular event, so that the team took it out anyway. The responsibility remains with the boat owner. That means that they must ensure there's a person on board who will ensure the protocols are followed in their absence. So bear that in mind, but nonetheless, the responsibility remains with the boat owner. So these are some of the more challenging admin questions that we came up with. So with that, that's the end of my my story, and thank you for your attention.
Thank you very much, Cathy and Dominic. And Cathy and Dominic will let you keep your video on for some question and answers, Q&As. Let's see. So we got several questions that have come up. One question was, how fast generally symptoms develop of a concussion? Maybe Cathy?
Yeah, so most of the symptoms will develop almost immediately. You'll see something, but it can take minutes to hours to develop. It would be unusual for it to take longer than 24 hours for the symptoms to develop, but I have seen that on occasion where the symptoms are probably attributable to concussion, and it's taken a little while longer for often the child or the adult to develop symptoms later. But it's generally considered within minutes to hours. And so you should be, if you're observing that person for the first 24 hours, you should be good.
Great, thank you. Another question is how to help someone, including oneself, if we see symptoms, but there's no 911 or medical practitioner available, or at least not available anytime soon.
So that might be the condition where there's a lovely picture of Georgian Bay behind me. And I could think of being up there and landing up with a lot of difficulty trying to access care. That's a difficult one because you really should access care somewhere or another. And in the days of cell phones, it would be very unusual not to be able to access the nurse that's available telemedicine in Ontario or telemedicine nursing in Ontario. We have all that. So things like that can be helpful to you if you're trying to figure out what to do when you're truly remote. If you're truly going to be remote, you probably should take some wilderness medicine, emergency medicine courses before you really go off and do things where you're going to be completely out of range of medical help. If you're just talking about first aid, like what do I do while I'm trying to get to shore kind of thing, then my answer would be, if you think the person has a neck injury, we talked about that, just leave them, try to keep them in a spot where they can just lie flat and stay there. If you've got someone who's got a minor head injury, same thing, I would try to lie them down, ideally on their side, so that if they happen to vomit, they're not going to vomit. It's going to be a little easier for them to clear it. So that's the recovery position that we talk about in first aid all the time, lying on your side, fairly stable. So that's what I would suggest if you're talking about just immediate first aid thing where it's going to take you 10 minutes to get in.
Great, thank you very much. And maybe just since we're with you, Cathy, can you elaborate on post-concussive symptoms?
So post-concussive.
Sorry, and just related to that, perhaps long-term symptom-wise, there's a question from Suzanne. Are individuals who have had several concussions at greater risk of dementia or Alzheimer's as a person ages? So the immediate symptoms first, I guess.
So the immediate symptoms first. So the post-concussion symptoms can last months to years afterwards. And they're all the symptoms that we talked about that you see with concussion. So you can see prolonged headaches, prolonged dizziness. That's a common one. People describing fog and cognitive problems where they can't seem to concentrate on things. And those, I have seen those symptoms last for a prolonged period of time. And every once in a while, you'll see articles in the newspaper about people who've had concussions and can't recover from them and are off work, and this has been going on for years at a time. It's not entirely clear if you have repeated concussions that you're going to be at high risk for dementia, because dementia has multiple causes. But they have seen, certainly they've seen dementia type illnesses in people like boxers, and they are looking at it in the pro athletes who get a lot of concussions. So it may be there. It's hard to know if, you know, you've had 2 or 3 smacks on the head, one with your car door and one skiing, whether that's going to make you at higher risk for dementia. At this point, I don't think we know the answer to that, and the answer is probably not, but we don't know the answer.
Great, thank you very much. A question for Dominic now. Do we have responsibility as a boat owner to drive the casualty when it's a minor injury to seek medical assistance? So do we, I guess as a boat owner, are we obligated to transport the person with the injury to seek medical assistance?
So I'd answer in terms of what the concussion recognition tool tells us to do with a person who may have concussion. And it says that they should not be sent home by themselves. They need to be with a responsible adult. So if you recall, the responsibility for performing that whole sheet lies with the boat owner. So whether they themselves are going to accompany the injured party home or to medical help, or whether they're going to delegate someone and ensure that it's done, you know, either way is possible. But right, they have the responsibility to ensure it's done.
Mm-hmm. And that should be whether we're a boat owner or not, but particularly as a boat owner, we carry that responsibility.
Yes, in terms of what we discussed today, in terms of our activities, yeah, the boat owner owns that responsibility for ensuring it's done by some method.
Yep, thank you. If someone, maybe for Dominic as well, if someone incurs a head injury on the dock, does an incident report need to be completed irrespective of whether a prescribed activity is being undertaken?
The answer is yes. The NSC has had an incident report form for many years. It has perhaps been used much less than it should. And our new sailing professional is going to change that and make it easier and more consistent. So the answer is yes. You know, any injury at NSC is actually reportable in the context of the club's requirements.
Great, thank you. Question maybe for Cathy, and it could be for Dominic from a legal point of view as well. But for Cathy, here's a new question that's just come in from Elizabeth. Should we rather call an ambulance in case of any doubt of the severity of the injury?
I think that's probably wise. The paramedics will come, they will assess the person themselves. They do have a lot more training than most of our sailors, and will be happy to look at the person and decide whether they need to proceed to hospital or not.
Excellent, thank you. All right, last chance to post, and here there is one. Okay, last chance to post any more questions while we're asking this maybe final or next to final one. From Alistair, since post-concussive symptoms can take time to develop, when an athlete gets hit but is not displaying symptoms, should we remove them from play?
And that's the hit, stop, sit rule, right? That Dominic showed you so nicely on some of his slides earlier, where yes, if they're hit, they should be sitting out until you can have a chance to monitor them more closely.
So in that case, if we're out on the water and somebody gets hit, we immediately have them stop and sit, and then have somebody begin to actively observe symptoms perhaps before we decide to, or do we come back to land right away? We observe the symptoms first, and if we suspect concussion, then return to land.
That's a more complicated question, but I would say, yeah, if you think that you've had a significant head injury, you're probably best to start heading towards land until you figure this out.
Well, let's say it's a light bump on the head that
So you're
doesn't seem
talking
so
about,
serious?
I'm coming out of the hatchway and I smack the top of my head on the cover for our companionway,
Which
is a
I've done,
frequent,
and I have drawn blood, yes.
which is, just remember drawing blood is not necessarily a sign of a terrible thing, but, you know, so you smack your head on the companionway and you do have a chance to sit for a minute or two to figure out what's going on and can somebody just watch you? And the answer is, for that kind of minor thing, probably yes. You get hit by the boom, I think you better commit. Or
So
if you have a
I
significant fall.
think it's very consistent with the procedure as we've defined it, which is, you think that a head injury may have occurred. Now we'll assess the situation, follow the concussion recognition rule, and after assessment, if you suspect concussion, return to the harbour region, and so on. So you know, there is a you know, in that, if and Cathy's going to tell me if I'm overstepping the bounds. You know, if the tool says no, that this person's clear, then how would you react to that point, Cathy? We can continue.
Yes, but you still have to observe them.
Right. Okay.
Great. One more has come in. Building on Dominic's scenario, if you bump your head, as he described, and you have had a previous concussion, is it best to stop and assess, or should you head for shore immediately?
Having a previous discussion puts you at concussion puts you at higher risk for having concussion symptoms again, but doesn't necessarily tell you what the severity is going to be. So I'm not sure if I'm answering the question quite, but I would say, yeah, just because you've had a previous concussion, you know, we still allow athletes to play. And if they get smacked again, they have to be cleared to return to play. And hopefully the concussion is happening a lot later down the road. But if they do have a second concussion, a second hit, that doesn't necessarily mean that they're going to have concussion symptoms. So I see kids who've been playing hockey and they get hit again, but they don't have anything. And then most of the kids that I see are the ones who get hit again, but now they have symptoms, but their symptoms might not be as bad as it was the first time, or it may be way worse than they had the first time.
I think, if I may, I think this is the reason why the concussion recognition tool is published by International Ice Hockey, FIFA, Olympic Organization, World Rugby, and the International Equestrian Federation. They're the people that are like us. Recognizing that those of us who would not spend their life in medicine don't know what they're looking for, and so they've given us a fairly simple and upfront and conservative set of criteria that people like me can read and follow. So I think that's the guidelines are there, and they've been put together by those teams for that reason. So we can run those assessments.
Great. All right. I think we have Tony. Did you want to say something?
I did, because what we haven't mentioned at all tonight, and I just wanted to remind people that we have this service on the Ottawa River. We had an excellent presentation last year from Ottawa Fire Service, and they have a rapid water rescue service. And sometimes I would think that the Ottawa Fire could actually reach you and return somebody to shore far more quickly than you can get there in your sailboat. And when would it be appropriate to ask them to help? And just to remind you, they're available on 911. Call 911, it gets to them. The most important thing to mention to them is that you are above the Lac du Chien Rapids. They never know which way to turn out of the fire hall sometimes when they get a 911 call. And they also say that they can reach a lat long, which you can get from your cell phone. So it's always good to learn how to get your lat long position from your cell phone. Give that to 911 and they will get to you quickly. But when would it be more appropriate for them to turn out rather than wait for somebody to return to shore?
Any of those red flag symptoms that we described.
Yeah.
and that are on the concussion tool.
So just to remind people that is probably a good option to use rather than wait to get somebody back on the sailboat.
Yes. And that did actually happen to me. And I called 911, and we had 3 fire department boats come out. They asked us to fire off a flare because it had gotten dark and we were aground. And one way that you can, but it took them, I think, about 40 minutes to reach us, but they were fantastic. One way an easy way to get your lat long off your cell phone is just tap on the map where you are, and those digits will be displayed at the top of the screen. All right, any other closing comments that anybody has?
Stephen,
Mark.
I'd like to ask a question, and it's a question to Dominic, and it relates to the people responsible. It is the boat owner, but a number of boats at the boat club are owned by syndicates, and I suppose each person is then responsible or not. So I'll just leave it up to you to respond to that.
Yes, we can dive down into the layer nuance as far as we like, but it's essentially going to be the person who fills in the registration form in most cases, but will take the responsibility.
Okay. Thank you.
Great. Okay, thank you very much, everybody, for asking questions. And thank you once again very, very much, Cathy and Dominic, for making yourselves available tonight and for preparing the materials. Thank you very much again for coming. Good night, everyone.